Good evening. So thank you all for joining us tonight. My name is Ted Hopper. I'm the chairman of the board here at LSA Family Health Service. As many of you know, for over 60 years, LSA has been one of East Harlem's most important institutional anchors. We're a cornerstone of the East Harlem community and a trusted partner to thousands of families who rely on our services. Now, it's no secret that East Harlem has been hit particularly hard by this COVID-19 crisis. But within 2 weeks of the shutdown on March 13th, and with the crisis growing exponentially, we at LSA had organized ourselves to ensure that our essential services, now more critical than ever, would continue. And today we want to express our gratitude to each and every one of you for your incredible outpouring of help and generosity. We're truly thankful to count you among our partners working on behalf of the children and families so greatly impacted by this pandemic. We want to share with you how your support has allowed us to respond to the needs of a community in crisis and to tell you about our plans for moving forward. Of course, before we get started, a few housekeeping items I want to note. To begin with, all participants have been placed on mute, but we have allowed for a few minutes at the end for your questions. So if you have a question, please send it to us in the Q&A chat at the bottom of your screen. We'll answer as many questions as we can at the end of the discussion, but if we aren't able to answer your question, we will follow up with you after the discussion. So to get us going, I'd like to introduce tonight's panelists. First, we've got Rita Ellis. Rita is the CEO at LSA and has an extensive background in nonprofit. She first joined us in 2014 as the Chief Development and Communications Officer and became our CEO in 2016. Now, prior to joining LSA, Rita spent many years as an independent consultant and on staff in senior positions at the YWCA of the City of New York and the Center for Social Inclusion. Rita holds a Master's of Social Work and has done postmaster's training at the Ackerman Institute for Family Therapy. Also with us tonight is Ray Lopez. Ray is our Director of Programs and our Director of the Environmental Health and Family Asthma Program. Ray lives in East Harlem and has a deep firsthand knowledge of the community's needs. He oversees nursing, advocacy and food pantry, and parenting and child development. His environmental health services team focuses on asthma prevention using a holistic, hands-on approach to improve housing conditions. Ray is also a leader with Metro Industrial Areas Foundations Manhattan Together, and their efforts achieved a landmark federal court settlement with the New York City Housing Authority, which aims to protect residents exposed to mold conditions that exacerbate asthma. Also on our panel tonight is Lucia Aguilar. Lucia is the Director of Advocacy and Food Pantry, and in that role, she oversees the food pantry and directs services to clients, connecting them to our other LSA and community services. Lucia also leads a team of advocates who assist clients with immediate needs, such as food, housing, employment issues, and immigration. On top of that, she is also a member of the United Way of New York City Advisory Committee. And our final panelist is Dr. Brenda Brathwaite. Dr. Brathwaite is our Director of Patient Services at LSA, and she's a nurse midwife with over 25 years of midwifery and nursing experience. Dr. Brathwaite has a doctorate in nursing practice from Rutgers University, and she's part of Sigma Theta Tau Honor Society and the American College of Nurse Midwives. Brenda also serves as an adjunct nursing faculty at Helen Fold School of Nursing, and she has mentored countless midwifery and RN students. So with that, I'll turn it over to Rita Ellis, CEO of LSA. Rita?
Mute. Welcome everybody. I am so thrilled to join Ted in thanking you for being here. Your support has really meant the world to us. We never could have been doing what we've been doing throughout this without you. I also want to take a minute to acknowledge our staff, particularly our frontline staff. Of course, Ray and Lucia, who are on with us, our hidden tech gurus who are managing, Colleen and Hetty, the nurses, the advocates, the food pantry folks, our facility staff who have been in the building every single day, to make sure the food pantry runs and the building is safe for the few people who are in and out of there. So those are our own frontline heroes. And I have to tell you, that includes Ted, who comes pretty much on Wednesday, sometimes with his kids, I think, to volunteer and help out on the food pantry. So Ted, at some point, perhaps you'll share your impressions of that as we go on. I think it would be interesting. So the staff has been incredible, and your support has really kept them all going and enabled them to do what they do. We've heard a lot about disparities lately, social, financial disparities, all kinds of disparities that impact how the people of East Harlem have been affected by COVID-19. What LSA does, and has always does, we were founded in the name of social justice, and having the kinds of basic things like food, health care, clothing are all matters of social justice for people. And that's what LSA does. We work to reduce those disparities as well as we can. And as the newspapers and commentators have pointed out endlessly, the comparisons with what's happening now are absolutely stark. And what I'd like to do, if you'll forgive me for looking down, is read you a quote that was published on May, about a week ago, from the New York City Department of Health, and it talks exactly to that issue. What it says is, as of May 18th, in zip code 10029, which is East Harlem, which is LSA's zip code, there were 1,698 COVID cases, almost 1,700 cases, and 182 deaths. The population that is 84% African American and Latino, with a median yearly income of $34,000. Now, compare that. The toll was markedly lower in the adjacent 10028 zip code, the Upper East Side, where there were 603 cases of COVID-19 as compared to 1,700 in Harlem, 34 deaths as compared to 182 in Harlem. The population that is 71% non-Hispanic white as compared to 14% non-Hispanic white in East Harlem, with a median income of $114,000 in zip 10028 as opposed to $34,000 in 10029. A lot of the families we serve have double and triple whammies. So not only are those poverty and the disparity in income and other things impacting our community, the immigration status of many of our clients and many residents in East Harlem is such that they are not eligible for either COVID-19 relief or unemployment relief. So they're all left out to hang on their own with help from places like LSA and folks like you. Today, we're hearing about children not having enough to eat. Millions of children across the country facing hunger and deprivation of food. So, just the fact that LSA is still there, still providing food, still providing services, provides hope to the people we serve and to the entire community. And I am of the firm belief that hope is almost as critical as food. So on that note, I think I turn that over to Ray or Ted. Are you?
Sure.
Do you want to
Rita, thank you for those comments. It's really puts it really in perspective, especially the data you shared around the adjacent zip codes. It's just incredible. So let's talk a little bit about what LSA has done over this last couple of months. And I'll turn to Ray first. Ray, I think I can speak for the board and the community. We were incredibly impressed with how quickly and effectively the program staff was able to respond to the COVID crisis as things really started to escalate in the middle of March. So do you think, can you expand a little bit on how you did that and what you're doing now?
Sure. Hi, Ted. Hi, everybody. Thank you for allowing me the space to step back and think about these issues and share along with you our work. I've worked at Little Sisters for 19 years, and I'm still in awe at the devotion to the families that each and every one of our direct service workers demonstrates. From the early days in March to now, they have been working at an unbelievable rate. They are in constant contact with their families, and I think that's what's made us successful is their devotion, but also the constant feedback that we're getting from every individual family. And we have 25 program staff, direct service staff. We have, they're in contact with 1,073 clients. And that's, more than 4,000 people, members within those households. And so each team is meeting daily. And so after they have, their half a dozen or so conversations per day, they're going back and sharing what they're hearing in the community. That was sort of the beginning phase of just trying to hear out what the families are being affected by. Then we had weekly meetings where the different teams were sharing and quickly trying to find resources to urgent needs. Very reactive, but very, very timely. And the direct staff were very resourceful and creative in the ways that they connected people to services, all doing it from their homes. In parallel, we were trying to make sure that every worker had the technology to work from home. I mean, a lot of them are so used to visiting people in their homes or having, providing services in the office setting in person, that all of a sudden, we're in this situation where we're all working from home. And so figuring that out and making sure that everyone has what they need so that they can easily communicate with their families. That led to the development of all sorts of policies. And we had to, start from scratch basically and figure out how do we give out food to as many people as possible while keeping our staff and our volunteers safe. Finding resources for all sorts of things, whether it's food insecurity, financial insecurity, needing health, needing to get a test, you name it, our workers were figuring out what was available and trying it out and coming back to the rest of the team with feedback. Lucia, do you want to share a little bit about what you've encountered, not just in the food pantry, but also with your client advocates?
Good evening, everybody. Thank you for joining us today. Yes, we in the advocacy department, we know our community and we know food was going to be an issue. We decided to open up the food pantry and, like Ray was saying, what was the easiest, safest way for us to provide for our community, given the new guidelines due to COVID. It was very hard. Before we were able to provide our families supermarket style pantry, they were able to go inside, choose their items. But now, because of COVID, we were not able to do that. But we were still able to provide meals for these families. We went from seeing 200 families a week to 700 families in a given week. And Ted can speak later on that. Like, it's a lot of families, but the need is there. Families are coming every week to our food pantry, and that's just the food pantry part of it. We were very lucky to get a huge amount of volunteers who are willing to come out and help our food pantry. They're coming twice, coming a day before to help us pack 300 bags at a time, getting them ready for the next morning. So our volunteers are ready to start on Wednesday morning to give them out to the people who are in line to stop. We don't want them to stand there more than what they already are. So we're trying to speed up the process as much as we can. And that's why we're preparing bags to just hand them over to the clients so they could go home as soon as possible. Um, we also continue to do our services. We know that a lot of families are lost their income because they were lost hours or they were laid off. So we also continue to provide our services to our clients and assisting them to apply for food stamps and public assistance. We were connecting them with the service. We were doing that all remotely through the phone, speaking to our clients. They were telling us their concerns, and we were assisting them in all the ways that we could, trying to connect them with meals. We were also very fortunate to extend our partnership with United Way, that we're able to deliver meals to our seniors and anybody who's immunocompromised directly to their home. And that's something very important, especially for our seniors. And as you know, East Harlem has a very high asthma rate, diabetes, which puts clients at higher risk to COVID-19. So those are a few ways that advocacy has been helping the community.
Terrific. Thank you both for that. Incredible. I will say, it's been mentioned a couple of times, I've been down to the food pantry on Wednesdays when they're serving the community, helping out with volunteers, and it's really an amazing effort. The number of volunteers that are there, as Lucia said, both on Tuesday, packing the groceries and then distributing. Every time I've been there, the line at 9 a.m., even before 9 a.m., starts in front of the building there at 115th and stretches all the way down to, I guess, that's 2nd Avenue and even around the corner. So if there was ever any doubt that there is a need, a demand for the types of services LSA is providing, there's no more better evidence than that. So Ray, I'm going to turn it back to you. Talk a little bit about, if you will, please, just what are the current needs? We've heard a little bit about what is happening on the ground, but maybe you can expand on that a little bit. And what do you expect the needs to be over the next, say, 6 to 8 months? And how do you anticipate LSA will deliver those services between now and the end of the year?
Sure. So I think that the current needs will remain to be food and financial support. And we are addressing this in multiple ways. One is we, of course, are providing food ourselves, but we are also engaged in being a sort of a community navigator for our community members and connecting them to the myriad of services that the city and other nonprofits are providing around food and delivering food to homes, including some of the food now that will start coming down from upstate New York and outside of New York City from the farmers markets. In addition, we are trying to find ways to provide financial support to our community members, and we're doing it in a number of ways. We're part of a couple of cash assistance programs, one that's coordinated by Catholic Charities, another from New York Immigration Coalition, and we have a couple partners who have set up funds for our families. One is a nonprofit called Groove With Me that's been a long-time neighborhood partner. And another is headed by an individual who was a volunteer and an intern with us for many years, Evie Yeager. And what we're doing is basically mimicking a stimulus check for our families that are not eligible for it. And so we're in the process of re-granting these funds to help people financially. The other part is really making sure that we are all on the staff up to date with everything that's emerging. So, this past week we learned about money coming through the Department of Education that will get to every family. that's in lieu of the food support in the schools. And so a lot of this is about us now communicating to our families and telling them what this is about, how it will get to them, how much it will be, and making sure that they understand that they are all eligible for it if they have children in schools. The next 6 to 8 months, it will be very tricky. You know, we've all been working day in and day out, long hours. I mean, I think our 9 to 5 schedules have been long gone since mid-March. And, you know, we're understanding that this is going to be in place for many months, you know, probably until this elusive vaccine, maybe hopefully sooner. And so we need to find a way to operate where we're responding to our clients, but in a sustainable way. And so, you know, the lines in the food pantry were scaring us. But, you know, I think now we're getting the hang of it each week. We're learning each week. The food supplies are steady. There were some interruptions in weeks past, but we're getting the hang of it. And now we're registering our clients. We're registering anyone who's on the pantry line. So we're bringing in new people into our organization and starting to learn about them. We've also today launched a COVID-19 survey that's going to go out via mass text to about 1,500 of our clients who we've served in the last 12 months. So I think there we're going to systematically learn things that I think we've heard anecdotally from all of the direct service staff about needs, about emerging needs, and, you know, information I think that will point the way in terms of how we modify our services going forward.
Thanks, Ray. Brenda, can you chime in here on some of what's going on in your area around patient services?
Nursing has been on the front line from the very beginning. We've basically had to adapt to telehealth, telemedicine. And so in the beginning part, we had to, you know, I had to really change what we did. In order to keep the community and the nurses safe, some nurses would go and take care of the geriatric patients, and another group of nurses would just focus on maternal child health patients. And what we saw, you know, in terms of some of the things that were affecting the community is a lot of women, they didn't have enough supplies for their children, whether it was formula, diapers. They needed equipment such as cribs, high chairs, because they just couldn't get around to buy these things, or they, you know, because of the fact that we had to social distance and stores were closed down. And then with the elderly patients, the geriatric patients, we found that the social isolation was really getting the best of them. So many of the nurses served as their families because they couldn't see their children. So when nurses would go do wound care, if it was one patient, it was her birthday, she wanted Kentucky Fried Chicken, we reached out, we bought it for her. We took it to Vista. We all called her and wished her a happy 80th birthday because it was a milestone birthday. She really appreciated it. Another patient in the community, she appreciated the fact that we came every day and did her wound and it got better, that now she's gonna donate to LSA in the hopes that someone else can, you know, get the help that she was so fortunate to get from the LSA community.
Thank you both for that. So we've heard a lot about what we did to spin up and adapt to this rapidly changing environment and some of the current needs we're fulfilling. But Rita, I'm going to turn to you and maybe you can give us a little forward-looking perspective. What do things look like? What kind of services do you anticipate LSA will need to add or expand or perhaps adapt and change to meet the longer-term needs made worse by this pandemic?
Mhm. Well, that's something we're thinking about and beginning to talk about now. One thing for sure, we think that there will likely be some combination of on-site and virtual programming. For example, after school, we're making an assumption that schools will reopen and that schools also will be part-time virtual, part-time in person. And so we would do our after school. So it would be in person on the days when kids are virtual in school, and virtual, in the days when people would come in here. So every single day, kids would have at least one opportunity for a face-to-face learning experience. We know, especially for younger children, that the online learning is not the best way to go. It's a stopgap measure, really, and insufficient in and of itself. Mental health. We need to do much more with mental health. We think that the mental health issues are going to be enormous in our community in particular. We were already seeing many mental health issues because of immigration policies and the stresses that put on families. Now you add to it the COVID and the isolation, and then you add to that the fact that the local economy in East Harlem are small stores. We do not have big box stores, within a 10-block radius of where we are. And many of those stores are family owned, locally owned. My hunch is many of them will go out of business, and that again, that will even further impact the mental health of our clients. So that I think will be a high priority for us going forward. Part of that will be expanded home visiting capacity, particularly in our parent and child development program, because of the lack of access to homes right now. There has been a lot written about increased domestic violence, increased child abuse, without any ability to monitor what is going on in the home. So more home visiting along with more mental health. We strengthening the nursing program clearly. One of the things that has been happening now is that because all non-emergency surgeries, voluntary surgeries have been canceled, it's also impacted, what our nurses are doing. And we expect that as more patients are recover from COVID and are discharged to home, that the need for home nursing care around post-COVID complications is going to increase. Continue with best practices research. We've done that for a long time with NYU, the New York Academy of Medicine, and other partners. And we think with the changing circumstances, and life-changing, one commentator compared it to the Industrial Revolution in terms of magnitude of change. So we will continue to look with our research partners, best practices, how do we do what we do even better? And of course, much more around food security. I don't think the food issues are going to go away anytime soon. So those are some of the major things that we're looking at as we go forward.
Great, thank you for that very much. I'm going to turn it over to the audience for our questions. Again, if you have any questions, there's a little, if you look at the bottom of your screen, you may need to move your mouse down. There's a little button that says Q&A. Click on that and enter your questions there. We already have a couple questions from the audience, so I'll just kick it off with those. The first one is, have there been any supply chain issues in keeping the food pantry operating? I'll let whomever wants to field that, go ahead.
Yeah, I'll start, and Lucia, you can chime in if I missed anything. Yeah, so there have been, and it started out in the early weeks that we hit our credit limit with our 2 vendors, so we had to get that increased. We had to speed up our invoicing and payment cycle to make sure that we had enough room to order. We fixed that. Then we had issues where the vendors were understaffed. They just didn't have enough people in the warehouse. They didn't have enough drivers to deliver the food to us by the Wednesday distribution date. And so, you know, with the immediate surge in demand, we depleted our inventory and had a couple of weeks where we had to cancel the afternoon session. But I think we've increased the number of vendors and are continuing to increase that. You know, I think that we had sort of figured it out. Every week has been a sort of new barrier that we've had to sort of troubleshoot and resolve.
Yes, what Ray mentioned is correct. We had issues with the vendors. You know, sometimes items would get substituted. Sometimes we would get half of the items we donated. So that caused a big issue with us and the food pantry. And as you know, the numbers were growing. So that prevented us from providing food for like the whole community. So like Ray said, we are looking at other providers. You know, we're also looking into getting another freezer because as a result, since the companies do not have drivers, they want to merge deliveries and we don't have the storage space in the freezer. So we're also considering that option.
Next question from our audience. How is prenatal and postpartum care being delivered currently? Brenda, you're muted.
So, did I unmute myself now? Yes. Okay. So we're still basically functioning the same way. The only thing is we have some telehealth incorporated into that for the safety of the nurses and the patients. So what we do is for our start of care patients, basically that's a patient that we're seeing for the first time. We try to get most of the history by telephone. And then, you know, we limit the time slot that the nurses go into the home. So we try, you know, I try to get them in and out of there and, you know, rehearse them to just get into the home and, you know, to keep the patient safe and the mother safe and just try to get everything done in an expeditious, efficient, and effective fashion. But we're functioning the same way. We're going into the homes. We're still seeing patients. Yeah, we're still conducting visits for moms, babies. Nothing has really changed, except, you know, the telehealth piece in terms of trying to get good history by phone.
Next question we've got is I'm going to direct to Rita. Rita, we've talked a couple of times tonight about how we've seen an outpouring of support. Can you just give a couple examples of how our supporters have stepped up and helped us during this period?
Sorry, I'm still getting used to this technology. Absolutely, in some amazing ways, actually. And these are two stories that I really love. Obviously, tremendous outpourings of cash, you know, and that food support. But one person in California, I think, called Anna, we're making the clear masks out of a 3D printer. So he 3D printed 50 masks and sent them to us. Another couple who had sent a contribution later emailed us to say she was a clinical specialist nurse at Memorial Sloan Kettering, and her husband was an oncologist at Memorial Sloan Kettering, and what could they do to help? So besides giving us donations, and this nurse saying, I'm going to give you whatever I make over my nurse's salary, they did a webinar. They taught our nurses how to get in and out of PPE equipment, which apparently is not simple or straightforward. They hooked us up with suppliers for the N95 masks. What else, Brenda?
They Sandy wipes, cloth mask, which still keeps coming, just very generous.
All kinds of things. Yeah.
Yeah.
You know, food drives. We have a partnership with Temple Sharei Tefillah on 79th Street and 2nd. They have been sending bags of backpacks full of food for a lot of the children that were in our our after-school program. They've gotten their volunteers to come in. We have gotten volunteers to help in the food pantry from, I don't know, St. Francis de Sales, from a million people who have offered their cars to help us pick up food from Hunts Point. It goes on and on and on. And it's just, it leaves me speechless. And really, I just want to cry at how generous and wonderful everybody is.
It's really been amazing. There's no question about it. I think we have time for maybe one more question. I think I'll send this one your way, Ray. And the question is, can you discuss how we are supporting our after-school students?
Sure. So, yeah, I think the first phase of our response with the after-school students was finding out how they were faring in terms of connecting with their schools. So, you know, JD and Elizabeth and some of her other volunteers helped to make sure that each student had a device and that they were connected to the internet and that all of that was working, and then they were actually attending the classes. And that took a number of weeks, and there were, you know, a lot of barriers at the beginning, but all of the students are connected now and learning. After that, Jade and her team began the social emotional learning sessions by grade, and really these are Zoom meetings between the teacher, the staff, and the students. And they had sessions, you know, I remember one of them being a sort of show and tell of, you know, something in the home that they wanted to share that comforted them. And so it's gone from there. You know, now there are one-to-one sessions with the volunteer tutors and the students, and we are planning now the summer session, and, you know, knowing now that summer school will be virtual and that many students will have to go to summer school and others have the option, we are interviewing all of our families to see what they're deciding and then designing our services to complement that, you know, sort of how Rita mentioned. And so our priority is going to be to continue to engage those who are already in our program, and we're going to aim at retention there, because bringing in new students virtually at this time we think will be difficult, because there's already a rapport amongst the group, and we are thinking about that possibly for the fall.
I just wanted to add very quickly that many of our staff actually did not have the technology for this connectivity, as well as many of our clients not having it, as well as connectivity in East Harlem generally being really poor. So Mackenzie, if you're on, a special thank you to you and Robin Hood for the technology money that allowed us to purchase the laptops and phones we needed, not just for our clients, but for our staff at home as well. So special thank you to Robin Hood for that.
Okay, well, we're just about at the end of time. I want to thank everyone who attended tonight. Of course, everyone who spoke, Rita, Ray, Lucia, Brenda. I also have to pause and thank Colleen Kopchick and Hetty Jarvis on the back end. They've been transparent here, but they've made this really happen. Everyone has nimbly adapted to this remote environment and allowed us to do these sorts of things. And finally, thanks to all of you for your continued support at LSA. We really can't do it without you, with your contributions, without your volunteer time, and continue to spread the word. Tell your friends, tell your neighbors. LSA is doing really important work in the East Harlem community, and we can't do it alone. So with that, thank you. Have a great evening. Enjoy the rest of your week.